So good day. My report for today is about a type of trematode which has the genus Schistosoma and the species japonicum. So Schistosoma japonicum is one of the three major human Schistosoma species. They are the Schistosoma species that infect humans and can cause schistosomiasis, and the others are the Schistosoma mansoni and the Schistosoma hematobium. So let's not tackle about those other two. Let's focus on Schistosoma japonicum. Schistosoma japonicum can be found in several countries in Asia. Some of these countries rather are the following: China, the Philippines, and the Sulawesi Island in Indonesia. Despite being called Schistosoma japonicum, this type of parasitic trematode worms are already long gone in the country of Japan, and these Schistosoma japonicum can cause intestinal schistosomiasis. So I've mentioned several types of Schistosoma earlier, and those Schistosoma species have different effects on people, but they also can cause schistosomiasis. So it can be urinary or intestinal. So the Schistosoma japonicum can cause intestinal schistosomiasis. So what is this intestinal schistosomiasis, and what causes it? So intestinal schistosomiasis is is caused by the reaction of the body to the enzymes or the chemicals that are expelled by the eggs of the Schistosoma japonicum to the body of a person, and the body would express an intense inflammatory response towards the worms that are inside the body. The disease is not about the infection that are caused by the adult worms, but rather the eggs. So intestinal schistosomiasis is characterized by abdominal pain, diarrhea, blood in the stool, liver enlargement, and enlargement of spleen, which can also be called as hepatosplenomegaly, or the swelling of both these organs, and the appearance of fluids in the peritoneal cavity or the abdominal cavity. So let's move on to the life cycle of the Schistosoma species. Let's go to the first stage, which is the eggs are being expelled or disposed in the fresh water by an infected host, where for the case of Schistosoma japonicum, it is expelled through the feces of a person or the animal that was infected. It can be a cow, a dog, a rodent, or a human person. These eggs would then develop into miracidia. It would hatch and release miracidia. So miracidias are the larvae stage of the Schistosoma japonicum, and it would then swim freely in the fresh water and then penetrate the snail, or what we commonly call kuhol, that are in the water, that is where the uh, the stool that was expelled at. So the eggs or the myristidia that has penetrated the snail would then undergo sporocyst. So sporocyst is the somehow the zygote stage of the uh, parasite, and then once it already complete its 2 levels of sporocyst in the body of the snail, it would then come out again and would develop into a new stage that is what we call cercariae. A cercariae is also a free swimming larvae stage of the Schistosoma, but they are similar with Myristidia, but Myristidia is from the egg to the snail, so it's from hatching to a host, while the Cercariae is from a host, which is the snail, to another host, which is the person or the animal that would tread the water that where the snail is, and then this Cercariae would swim and penetrate the skin of the human, and then it would becoming a parasite that would then what do you call this, infiltrate the body of the person, passing from the veins, going to the lungs, then to the heart, and then develop into the liver. So that's where they somehow that's where they stay, and then some of the eggs that are exposed, that are in the liver, would then be carried out when a person is dumping their body waste, or they are being carried in the stool of the person. And also, a female Schistosoma japonicum can lay eggs about 3,500 per day, and only few of these eggs would be carried out to the stool, and most of the eggs that are laid would then be staying in the body, or would cause the body to have schistosomiasis. So let's go on with the diagnosis of schistosomiasis. So schistosomiasis is being diagnosed through the examining of stool sample. So the stool sample will be examined if there is a what you call this, there is eggs of the Schistosoma japonicum in there, so they could tell if the person has schistosomiasis. And also the treatment that are being used in schistosomiasis patients are praziquantel, and it is also used here in the Philippines. It is used in 40 milligrams per kilogram dose, and it is observed and proven effective and in the patients that are diagnosed with schistosomiasis. So I think that would be all about my report.